Hello and welcome. Today we're diving deep into a specific type of kidney stone, drug-induced stones. These stones form as a direct result of certain medications, and understanding them is crucial for both healthcare professionals and individuals taking prescription drugs. We'll explore the causes, mechanisms, symptoms, diagnosis, treatment, and prevention of this unique condition. So, what exactly causes drug-induced stones? The key lies in the drugs themselves. Certain medications, when metabolized and excreted by the kidneys, can lead to an abnormally high concentration of specific substances in the urine. Some drugs directly precipitate out of solution, forming crystals. Others can alter urine pH or inhibit the body's natural mechanisms for preventing stone formation. Common culprits include diuretics, certain HIV medications like Indonaver, the anti-epileptic topiramate, and even some over-the-counter antacids containing calcium. Now let's get into the nitty-gritty of how these stones actually form. The process begins when the concentration of a stone-forming substance, such as a drug metabolite, exceeds its solubility in the urine. This leads to supersaturation. Next, crystals begin to nucleate, meaning tiny crystal seeds start to form. These seeds then grow and aggregate, eventually forming larger stones. The location of stone formation can vary, but it often occurs in the renal tubules or collecting ducts. The stone's composition depends on the specific drug involved. For example, Indonaver stones are composed primarily of Indonaver itself, while topiramate can increase urinary citrate excretion, leading to calcium phosphate stones. Epidemiologically speaking, it's difficult to pinpoint the exact prevalence of drug-induced stones, as they often go undiagnosed or are attributed to other causes of kidney stones. However, with the increasing use of prescription medications, the incidence is likely on the rise. Certain populations, such as individuals with pre-existing kidney conditions or those taking multiple medications simultaneously, may be at higher risk. Also, patients prescribed high doses of implicated medications or those with poor hydration habits can be more susceptible. The signs and symptoms of drug-induced stones are similar to those of other types of kidney stones. The classic presentation involves intense flank pain, often radiating to the groin. This is known as renal colic. Other symptoms may include hematuria, or blood in the urine, nausea and vomiting, dysuria or painful urination, and increased urinary frequency. If the stone obstructs the urinary tract, it can lead to hydronephrosis, or swelling of the kidney due to urine backup, which can potentially cause kidney damage if left untreated. It is important to note that some patients may have silent stones, meaning that they do not experience any symptoms. Diagnosing drug-induced stones involves a comprehensive approach. First, a detailed medical history, including a review of all medications, is essential. Imaging studies, such as a CT scan or an ultrasound, are typically performed to confirm the presence of a stone and determine its size and location. Urinalysis is also crucial to check for hematuria, infection, and crystalluria, which can provide clues about the stone's composition. Finally, stone analysis, performed on a collected or retrieved stone, is the gold standard for definitively identifying the specific compounds present. While we don't classify drug-induced stones based on broad categories like calcium or uric acid stones, it's useful to classify them based on the offending drug. This allows for targeted treatment and prevention strategies. For example, we can speak of Indonaver stones or topiramate-induced stones, each requiring specific management approaches. Understanding which drug is causing the stone is crucial to effectively manage the condition. Treatment of drug-induced stones focuses on relieving symptoms, removing or dissolving the stone, and preventing future recurrence. Pain management is crucial and often involves analgesics, such as NSAIDs or opioids. Increased fluid intake is vital to help flush out the urinary system. Depending on the stone size and location, other interventions may be necessary. These include alpha blockers, which can relax the ureter and facilitate stone passage, shock wave lithotripsy SWL, which uses sound waves to break stone into smaller fragments, ureteroscopy, which involves using a thin scope to visualize and remove the stone, or, in rare cases, percutaneous nephrolithotomy, which involves surgically removing the stone through a small incision in the back. Discontinuing or adjusting the offending medication under a doctor's supervision is often a key step in treatment. Prevention is paramount in managing drug-induced stones. The most important step is to maintain adequate hydration by drinking plenty of fluids, especially water. For individuals taking medications known to cause stones, regular monitoring of urine pH and stone-forming substances may be recommended. Dietary modifications, such as limiting sodium intake, can also be beneficial in some cases. In certain situations, prophylactic medications, such as potassium citrate, may be prescribed to help prevent stone formation. Consulting with a healthcare professional to discuss potential risks and preventative strategies is crucial before starting any medication known to increase stone risk. The prognosis for individuals with drug-induced stones is generally good, especially when the condition is diagnosed and treated promptly. With appropriate management, most stones can be effectively removed or dissolved, and recurrent episodes can be prevented. However, if left untreated, kidney stones can lead to complications such as recurrent infections, kidney damage, and even kidney failure in severe cases. Recent research has focused on developing novel strategies to inhibit crystal formation and improve drug solubility in the urine. For example, studies are exploring the use of nanotechnology to deliver drugs directly to the stone, enhancing their effectiveness. Further research is needed to fully understand the long-term implications of drug-induced stones and to develop more targeted preventative and therapeutic strategies.